Love that everyone's trickling in, joining us for today's session.
Thank you.
Buenas tardes.
Buenas tardes.
Mi nombre es Alma Lopez. I'm Alma Lopez. My pronouns are ella, she, her, and I'll be your host for today. We're going to get started in a few minutes, but in the meantime, I do want to invite you all to share your name and your pronouns in the chat box. And if you can also answer the following question, who am I here for? So you may be joining us today for yourself, for your familia, the people that you work with, someone that you care about, maybe your followers that look to you for information. So the question is, who brings you to this space today? And I do want to just make a few comments about pronouns while folks respond in the chat box. So you can also rename yourself and include them in your name. But pronouns are important because they tell us how to direct ourselves towards others, and they challenge our understanding of binary thinking and behavior. So there are more than two genders, and it's important to understand that humanity is expansive and that we exist within and outside of these realities. So again, we invite you to share your pronouns, include them in your name as you introduce yourself in the chat box, and also tell us who are you here for today. And as folks write stuff down, I'll be reading it out loud as well. Welcome here for my community and for myself. There we go. It's important, right? These are aspects that ground us and remind us why we keep fighting the good fight. Welcome, Caro. For the folks that you work with, awesome. For our community, hi, Stephanie, welcome. Hola, Denise. For your family and your community, thank you. Yes, and as folks are joining us, once again, mi nombre es Alma Lopez. Welcome to this space, to this training. My pronouns are ella, she, her, and I will be your host for today. So real quick, just so that folks know, I am the organizer, director of Brown Issues. And in our organization, our mission is to cultivate the next generation of Brown leaders. We want to invest that time, equip them with the tools so they can be change agents, storytellers, and lifelong advocates for community change. I'm excited to meet you all and to learn a little bit more about what you all do and how we're gonna ensure that our community receives this information, which is crucial for our health. Bienvenida, Irma. And so real quick, just some logistics. We do have Spanish translation available. Tenemos traducción en español disponible. So si quieren ver los controles en la parte inferior del Zoom, puede hacer clic en el símbolo de mundo. Hacen clic en interpretación, después en español, y van a poder escuchar el audio en inglés muy bajito. Pero si quieren eliminar el audio por completo y solamente escuchar la interpretación en español, van a hacer clic en mute original audio o mute original audio. Y les vamos a poner también las instrucciones en el chat box para que también las puedan ver de ahí. Déjenos saber si tienen alguna pregunta. Awesome. So also just for folks, in terms of Zoom functions, I think Many of us may be like Zoom experts by now. But I do invite you to have your camera on if you would like to, or maybe when we break out into groups. It's okay to also have your camera off. But if you want to rename yourself and include your pronouns, and also maybe the organization that you work with, that would be amazing so that folks can also connect. And we'll also just to be mindful and to mute yourself, put any questions in the chat box, but we'll be sure to also have some time amongst ourselves to share any thoughts, questions, or ideas. I do want to make sure everyone knows that this presentation is being recorded. And so we'll be sharing the recording, the slides with all the participants in a follow-up email. And right here we have the Health Squad, the Dream Team. It's a powerful team that's going to be sharing their expertise with all of us today. And we have Héctor Trinidad, Araceli Navarro, Gabi Tilley, Maribel Cruz, Najaira Valdovino Soto, and your host, myself, Alma Lopez. So once again, thank you for sharing your name, your pronouns, and who brings you here today. We're gonna get started soon. I'm really excited to meet you all, to share this space with you all. And I think one thing that I definitely wanna uplift is that we're here because we care about human life. And regardless of politics, our community, our gente, they're suffering and our community is dying. So we need to make sure that we advocate for healthcare, right? It's a human right. So really quick, why are we here today? We're here to prepare you to promote immigrant health. And how we're gonna do this is by understanding the impact of policy on immigrant health. We are gonna be reviewing the hub, content and messaging. We'll be learning about services, structure, and the structure for immigrant health. And we'll also have a section where we can brainstorm creative ways and strategies to promote immigrant health. So we're excited about this coaching session that we have planned for you all today. We will start by learning the body scan tool to heal from the impact of policy. We are then going to share with you all the content that we have on promoting immigrant health. We will review, like I said, the content hub, the services, the healthcare system, and very important messages, consistent messaging. Then we're going to jump into that brainstorming session to think strategically. How can we ensure that this information reaches our community, our parents, our grandparents, and the rest of California? So we have an important task, an important mission, but I'm excited that we're joining this fight together. I am going to pause real brief just to see if there's any questions about the flow of the day and our time together before we go into the body scan tool. Bienvenidos a todos, bienvenidas. I don't see any questions, so we're going to go ahead and pass. I'm going to yield the floor to Héctor so we can talk about the body scan tool. Take it away.
Gracias, Alma. Hola, hello everyone. Buenas tardes. My name is Héctor Trinidad Plasencia, and I'm the director of Plasencia Consulting. We wanted to be able to start off by doing a body scan tool because we know that if you're here today, you're a part of the immigrant health movement. By being here today, you are the immigrant health movement. So what we know about movement work is that it can consume us. It can take control of our mind mentally to the point where we can often neglect our body, and it can often harden our heart. So part of our work can be in our ability to be sustainable and our ability to be effective in creating change. We want to be able to move our body into the conversation and reconnect with our body and learn to provide our body pleasure in various ways. This is a part of us understanding the our ability to feel our freedom and our liberation in a much deeper way. So as we're going through this information, we want to share this tool with you. It's called the body scan tool. And the body scan tool gauges your level of comfort. This is helpful outside of this work as well, in your professional life, your personal life, in different spaces and around different people. Being able to check in with yourself and to see how comfortable you are in those spaces. Am I feeling extremely uncomfortable? Very uncomfortable, somewhat uncomfortable, mildly, or not at all. I feel very comfortable here. And so we do this by asking ourselves questions. Do I feel pain anywhere in my body? Is my body uncomfortable? Where am I feeling uncomfortable? So notice as we hear different information and we learn about the reality of what it is to be an immigrant and undocumented, trying to access healthcare, do you feel any discomfort in your body? Or quite the opposite, did your body check out? So the idea is not to be able to judge yourself about what you're feeling in your body, not to say this is good or bad. Just like Alma mentioned about pronouns, we're trying to get away from binary thinking. So we don't want to think about them about good or bad. We want to be able to develop a relationship with our body so we can provide them the attention that they need. So we can start by doing some very simple, gentle touch, being able to have some sort of contact with our body where we say, sometimes when we need to calm ourselves, just remind ourselves that we're okay, being able to hug ourselves. Stretching also helps, getting curious about your body's needs and attention and care. So go ahead and try it and see what your body is feeling and see what you may need to be able to give yourself attention and care for yourself in this way. Also go ahead and try it for the rest of the week and see if it's helpful to you and the work that you do. Gracias.
Gracias, Hector. I really appreciate this tool. I think sometimes we do have to pause and check in with ourselves and ask those questions. And next I'm gonna ask Gabi. Yes, we're gonna go ahead and jump into the Content Hub. And thank you, Gabi, for getting us into that slide. I'm gonna introduce our compañera Araceli to walk us through this slide.
Hi, good evening, everybody. Thank you so much for being here. So I wanted to share with you a little bit about our Content Hub and what is included in it. This has been a labor of love for some time now, and it's been with real intention to make sure that the materials and resources that are made available through this are customizable, personal to you all in the communities you serve, and really with the through line of consistent messaging. And so it includes materials such as PowerPoints, flyers, and social media. We know social media is a way to reach people. And so wanted to make sure we walk through that community hub with you all as an example of the kinds of materials that are available.
Thank you, Araceli. Then we're gonna go ahead and jump into promoting immigrant health 101. And I'm gonna ask our compañera Gabi to lead this section.
Thank you, Alma. So yeah, just like Araceli said, this has been a labor of love. My name is Gabi Tilley. I'm a policy advocate with Nourish California. And the information that we're sharing with you today is an evolution of how us advocates communicate with immigrant communities about the policies that impact them. So I'm here to stand up for people's access to food. I'm passionate about food. I love eating it. I think everyone else should too. Araceli defends children's rights, Hector in health and immigrant rights. And so all of us came together to really figure out how we were going to communicate this awful policy change that was public charge. So a little overview of what that policy is. It's an immigration rule that allows immigration officials to deny somebody a green card or entry into the country if they think they're likely to rely on the government to support themselves in the future. So this has been in place for a long time, but the Trump administration decided they wanted to make it even harsher, to make it harder for folks to get a green card by saying if you participated in Medi-Cal or CalFresh or housing assistance, then we might not give you a green card. That's cruel and counterproductive and awful in many, many ways. So as advocates, we needed to figure out how we were going to communicate to the public about these policy changes while still making sure folks get what they're eligible for. So here is here's the final result. We have these wonderful documents in the hub for you to check out. The Stay Healthy flyer outlines all of the available services that people can get regardless of immigration status, and also a little bit about public charge and how to figure out whether it applies to you. Then we have our food flyer, which describes all the food resources that are available, as well as how that might interact with immigration, but of course, centering what is available over the possible interactions. And then this nice outreach sheet, this little half, you can print it double-sided, English on one side, Spanish on the back for handing out, and that just tells you all the services that are available, because that is the key takeaway, and that's what we're trying to elevate. Okay, I already explained what public charge is. So I said this was an evolution. We started this work back in 2018, 2019, and these are some flyers on the left-hand side, I think from probably 2019. You could see one is very text heavy. So the other, we were super excited to be having to get to share that one, but it still centers public charge, very large, right? And we started to realize like, that's not the takeaway. That's not what we want people to go home with, concern about the policy that is public charge. What we want people to take away is stay healthy. CalFresh, Medi-Cal keeps you healthy. There are free and affordable food resources for you. Your health matters to you and your family and your community, right? And none of these resources will hurt your immigration status. So that's what we really want to uplift: rights and values, things that people can really connect to on a personal level with their hearts rather than this policy with their mind. So here are a list of all the programs that are safe and open to all. And this is not exhaustive. There are still many, many more. I think most, public resources for folks that are low income are available to all. School-based services, right? Free meals, school meals, emergency health services, those are mostly available. The earned income child tax credit, thankfully to the expansion that California did recently. Now all people, even with an ITIN number, are able to get that credit, and a few other things. Emergency disaster relief, right? There's such a thing as disaster CalFresh, that's also open to everyone. And so rather than, concerning ourselves about the certain programs that do have restrictions, there are many options for folks to take advantage of. And then for the programs that do have certain restrictions, they're usually limited to what they call qualified immigrants. I don't like that term, but that's what we're working with: qualified immigrants and US citizens. So that's mostly people with a green card, legal permanent resident, and also folks who have a humanitarian status like refugees, asylees. These people and US citizens are eligible for the big three programs, which were threatened by the Trump's public charge rule, but now are open to all who are eligible. And that is Medicaid, known here as Medi-Cal, CalFresh, and Section 8 housing assistance. And eligibility is based on more than just your immigration status, right? It's also based on financial and other requirements. Your finance limits determine whether you're eligible, and in some ways will determine how much you get. Like for CalFresh, it determines how much your benefit you get. And so you also have to provide additional information like your housing costs and your work, all that. And so the more information you provide, you might get a higher benefit level. So it is important to tell folks to really share as much as they're willing to, and to promise, to let them know that their information is kept safe and that cannot be used for the purposes of immigration enforcement. And you can check out here on the right-hand side is an example of some of the income guidelines. These are for Medi-Cal, but most of these programs also have their own scales. And this is a key takeaway here. If you're eligible, it is safe. This particular slide is about CalFresh, but the same goes for Section 8 housing assistance and Medi-Cal. If you're eligible, it is safe. If you are not eligible, this is for CalFresh, but you live in a household with other folks, maybe you have a child who is a US citizen, you can apply for them, even if you're undocumented, and get benefits just for them. You won't receive enough to cover your food costs, but you can at least cover them a bit. And that also has no consequence for your immigration status. So this is important to let folks know, because right when this rule came out, we saw a big drop in the caseload of CalFresh participants who only were getting it for their children. And that kind of shows that immigrant households were dropping their benefits out of fear. So we want to really, really reinforce that. If you can't get it, you should still get it for folks in your house who can. And COVID care and vaccine, all free and open to everyone who is eligible. This is really important these days, especially now the vaccine is coming out. We want to really reiterate to communities that the government has stated very clearly that they want to make sure testing, treatment, and vaccines are available to all, free of charge, no immigration status requirement. Even USCIS, the immigration enforcement, had come out and said that as well. So this is another thing that we really want to repeat. And lastly, we have this great tool for folks who are still a little uncertain. Maybe if you do enrollment or outreach and you have the opportunity to sit directly with somebody and they may be hemming and hawing about whether they want to apply, you can whip out your cell phone and use this great texting tool. You just text the number, benefits or Libre to that number, and it'll ask you a series of questions about your immigration status and what you might be applying for, and let you know whether or not this will be a worry for your immigration status. So the information is all verified by attorneys, and it has a really consistent, easy to use. And so we find that that helps folks feel the comfort that they need to, fulfill and really submit that application for benefits. All right, and then I'll pass it back to Alma.
Thank you so much, Gabi. And we're going to have our compañera Maribel walk us through understanding the healthcare system.
Hello, everyone. Welcome to this awesome workshop. And, props to you all, because y'all probably worked 8 hours today and are, dedicating the time to spend with us this evening. So thank you for giving us a little bit of your time. My name is Maribel Cruz. I work with the Long Beach Immigrant Rights Coalition, and I'm so happy to be here to touch upon such an important subject that is healthcare, specifically understanding the system of healthcare. I want to ask folks in the call, it's an intimate group and I feel we can all participate. How many of you think, with showing your thumbs emoji, how many of y'all feel you have a great understanding of the healthcare system in the US? Yeah, that's what, that's what I thought, because I myself am, also very overwhelmed with the US healthcare system, specifically because I myself am undocumented, and throughout my entire life, it was always kind of like this thing where, like, oh my gosh, like healthcare, what is that? Like, how do I access it? Like, how does my family access these services? So I'm so happy to be able to provide you with information that y'all can provide to your folks in order for them to empower themselves to access these services, because that's what we are. We are just like a little tunnel to kind of flow this information to folks and have them feel empowered enough to access all these services that are available in the state of California. So if y'all will have access to these documents, the healthcare system, this is just for your reference. And I'm going to go ahead and start with just breaking down the types of programs that there are in the US. So there are 3 types of healthcare programs in the US. The first one is it's the public healthcare system, meaning that this system is for citizens, some immigrants who are low income or are eligible for Social Security. Programs that fall under this category are Medicare, Medicaid, and Medi-Cal. The second system tier is private. Basically, if you have money to buy health insurance, you can access different markets and purchase your own health insurance. That's a private market. Lastly is the employer. So if you work with a company that gives you benefits, one of those benefits could be healthcare. So that's another way that folks can get healthcare, which is great for the folks that do qualify for this benefit. So we're going to go ahead and move on to the next slide. We're going to go ahead and break down a little bit of what the private healthcare system is in the US nationwide. So we're talking about a federal law right now. It's called the Affordable Care Act. With emojis, can y'all indicate, have y'all heard about the Affordable Care Act? With a thumbs up? Yes, no, yes, okay. Of some of y'all, okay, perfect. So this is a law that requires private health plans to include basic health services. This is federally funded, therefore undocumented folks and DACA recipients are not included in the ACA, meaning that when tax season comes around, undocumented folks and DACA recipients won't have to pay the penalty for not having health insurance. So that's a great information to have, because a lot of folks sometimes have that doubt of like, you know, am I going to get penalized for not having health insurance if I'm undocumented or a DACA recipient? That's a no. And then some immigrants do qualify to buy a plan under this Affordable Care Act, but it's a limited list. And then we will provide resources in order for you to find out which immigrants do qualify for it. But for the most part, the Affordable Care Act, the services include preventative care, prescriptions, counseling, vision, dental, and vaccines. So that's the private health. We're going to go ahead and move on to the next slide, which is California. California has its, you know, we do things differently here. You know, we try to be on the edge of certain services, and of course, we would have our own private health plan. Covered California. Covered California is the state's ACA marketplace to buy private health plans. Some immigrants may buy a health plan through Covered California. And here's something that a lot of people don't know. Some undocumented people and DACA recipients can buy a health plan with a broker outside of Covered California, meaning you're going to have to pay market price values for this healthcare. As you can imagine, healthcare is expensive, so we are looking at, you know, a pretty steep fee monthly for undocumented folks and DACA folks that decide to purchase private health plan outside of the Covered California because they're not eligible for Covered California. But you know, COVID-19 has changed so much. Because of that, special enrollment is now available in Covered California. If you need more information, there is a link here that you can actually visit and find out more details about this program. We're going to go ahead and go to the next slide. We're going to super briefly talk about federally funded programs that most people that are residents and citizens do qualify for. So let's say Medicaid is the US public health program for low-income individuals. Medicaid covers citizens and some qualified immigrants, but not undocumented folks. That's very important. Medicare is the US public health program available for 65 and older or have a disability. It's also important to note that some immigrants have to wait 5 years in order, once they're considered qualifying immigrants, in order to access Medicaid and Medicare. So it is a pretty long wait for them to access these services. Just an FYI on that. We're going to go ahead and move on to my favorite program of California, because it provides healthcare for many people that I know. And, you know, for a bit, it provided healthcare for myself. So Medi-Cal. Medi-Cal is such an amazing program that all our communities have access to if they meet certain requirements. And what this means is California has actually been able to use state funds to expand Medi-Cal coverage to certain undocumented folks, which is amazing because, you know, LBIRC and a lot of the advocates in this room are pushing for healthcare for all folks, no matter immigration status. You know, we believe we all deserve healthcare in order for our communities to be healthy and to live with dignity. And, you know, Medi-Cal is one of those programs that people can access. So undocumented Californians up to the age of 26 can actually get full scope Medi-Cal in this state. There are two types of Medi-Cal, full scope and emergency. So those are the two types of Medi-Cal that people can access. So we're going to go ahead and go. So what falls under full scope Medi-Cal? Full scope Medi-Cal, COVID-19 testing and treatments, medical, mental health, which is super crucial for folks, and many more. Who qualifies for full scope? DACA recipients, any undocumented children and young adults 0 to 25 years old can qualify for full scope. Same with asylees, refugees, people with UNT visas, VAWA petitioners, of course, US permanent residents, US citizens. These are the folks that qualify as of today for full scope Medi-Cal. What is our goal? Well, what is my goal? To make this program accessible to everyone. So I really want to emphasize that as long when we are given this information to folks and telling them about these services, it's also important to add on the advocacy portion of this. It's like you can access these services, but there's so much more that you can advocate for. Like your tia, your grandpa, your uncle, they all deserve healthcare. So this is just a little bit of what can happen in California. So it's exciting to have folks realize that and be like, you know what? Okay, I'm gonna go fight for this too. I'm gonna go, push for policy and advocacy. So it's beautiful to see, and making this information easy to understand and digestible for folks is starting point to kind of get folks to advocate for themselves. Emergency Medi-Cal is also a great resource for folks who, as of right now, may not have any type of health insurance. I will speak personally. I was also the person that went to the emergency room because I didn't have any healthcare. So I was kept on delaying services. And I'm like, I don't want to go to the doctor. I don't have money for this. And this was me before I knew all of this information. I'm like, this information is gold. But how many of y'all have gone to an emergency room and waited hours to get treated? And that bill is expensive. And it's not the most efficient way to get healthcare in this country. So we want to push for preventative healthcare. Preventative healthcare can save lives. It can save families money. That's a big concern for immigrant families is, how am I going to pay for a doctor? And usually when some families need a doctor, it's already like a disease is already well in advanced stages that care is more expensive. So we really want to invest in preventative care. Emergency Medi-Cal, however, for right now is a great resource to have for those that don't have it, because it does cover COVID-19 testing and treatment, emergency services. So if people obviously have an accident or need that ASAP, they can get covered, and they can get covered for pregnancy under emergency Medi-Cal, which is amazing for those moms that are afraid to access services because of their immigration status. Who qualifies for emergency Medi-Cal? Undocumented folks that are 26 and above. So that's the key age range that folks qualify. We're going to go ahead and move on to the next one that we have here. COVID-19, we can't get around not talking about this because it's clearly the reason we're in the Zoom room. We're not together meeting each other. But, COVID-19 services under Medi-Cal are free, regardless of income and immigration status. Using these services will not harm your ability to change your status in the future. That's super key. If you have questions, want more information about how to access COVID testing and vaccines, please visit the link here. If you have folks that live in Long Beach and need access to either testing or vaccinations, please get a hold of me. We can register for folks for both services here in Long Beach. More than happy to do so. But this is a free resource that people should take advantage because, when it comes to COVID-19, people either need to get tested or get the vaccine in order to have a healthy community. We're going to go ahead and move on to the next slide. And then finally, just to finish off this portion of the program, all these services that we've talked about are really great and amazing, but there's a couple of folks that may not, qualify because of certain eligibility requirements. So it's important as advocates, as people who work with immigrant communities, to become informed of the services that are available within our county. So you can see the map here with all the different counties, and each county may have different services. So if y'all have any questions about that, please visit the localclinic.net and call before visiting, but the website is up and running. to find out about county health services and community health centers. These are, hubs that are a crucial resource to our communities. And the more that we know and are educated ourselves, the better information we can give folks in order to really, really guide them in this complex system that is the medical healthcare system in the US. So I think that are all, yep, those are all my slides. So thank you. And I'll go ahead and pass it along to Alma.
Thank you so much, Maricel. That was a wealth of information. Thank you. And for this next portion, we're going to ask our compañera Najaira Baldovino Soto to walk us through the repeat consistent messaging. That's what we need to just ensure that our communities understand what is available and accessible to them. So Najaira, I'll yield the floor to you.
Thank you to the team, and thank you to everyone here. My name is Najaira Valdivinos. I'm the Youth Engagement Coordinator for the IYC. And as someone who's also directly impacted and, undocumented head, it makes me so happy to see everyone here, just learning how to advocate and keep each other health and safety and thriving. So with that, I do have the honor of just going over through some of the consistent messaging. But I do want to go over first what a bit.ly is, because, we've been, dropping a lot of bit.lys and throughout the presentation. And we want to, part of it is to help you know how to navigate. And I think one of these is how to navigate, how to use a bit.ly, right? So just, a quick reminder that when you do use a bit.ly, it's just a short version of a link that will get you to somewhere else. And, we do recommend just first copying it, and then, select your Google, Safari, whatever browser you want to use, and then just paste it on, and then just click go. And then you'll be taken to, wherever you need to, which is the resources that we provided to you, right? And so with that, I will just now move forward. Next slide, please. To just begin our moment, and just, to repeat everything that's kind of been repeated already throughout the presentation. But I really just want to invite y'all to unmute yourself so we can feel the energía in the space, because we can't be in person, right, because of COVID. But let's just try to make believe, right? So yes, if you want to unmute yourself and then just repeat after me, and then I'll go forward and touching some of the other consistent messages. So if we're all ready, don't be shy, y'all. Alrighty, so. I am undocumented Californians have the legal right to use public services.
Undocumented Californians have the legal right to use public services.
Awesome. Health centers are a safe space to visit.
Health centers
are safe spaces to visit.
All right, and then like Maribel shared, you can always just go to your local clinics to check out where your local clinics are at, right? So with that, now let's just go to our key messages, right? Like these are the things that are going to keep us safe, because we're going to keep repeating it, right? Just echoing it out to the community to ensure that they know, right? And that it's consistent all the time. So with that, that's why we did the practice of repeating, right? That's just, to begin it and continue it. So, one thing again, that all public undocumented Californians have the legal right to public services. As an undocumented mujer myself, that's something I always tell my parents. I was like, Mom, this is no se te olvida, never, right? And that state and federal laws protect the privacy of information. So, again, these systems are in place and, to protect us, right? So let's use them, right? And in regards to COVID vaccines, we know everyone, part of, your health is, knowing what's best for your body, right? So that's part of the advocacy as well, to see like, maybe I want to learn more about vaccines, or maybe that's not for me, right? But regardless, we do want you to remind you to, tailor your message to respect the decisions of others, because that is also their right, right? To just say, I don't want it. No, thank you. No, gracias, right? And the simple fact also is just, I really want to remind people that it's free regardless of your status. And also, when you do get vaccinated, it is a moment where you kind of can say, goodbye 2020 and hello community. I can now be in person celebrating with y'all, like, hopefully, as we progress, we can meet in person now instead of Zoom, and share all these awesome strategies of how we can advocate for more health. access, right? And again, just if you don't feel comfortable getting vaccinated, you have the right just to continue to get tested, take precaution, because again, it's just, it's about collectively caring for one another, right? And again, lastly, public charge, just a small rumor, I would say just a chisme that was used to kind of scare immigrant community, right, from using these services, right? So let's just continue to just amplify that this is just a rumor. Let's continue to just share that this is all just, you know, things to prevent us, barriers, right? So let's just use the text. It's pretty easy. I would say a little bit easier than Bitly, but we already kind of gone over it. So we're hitting you both with like the text and also the Bitly, y'all. We got you covered. So we got it in Spanish, we got it in English. Spanish, you can use Libre, English, benefits, but you can also use the web, right? So just copy and paste, put it on your web browser, and then you'll get all the benefits there. And just, I really do want to highlight the key resources again. There's a purpose to going over the Bitly. So, you know, that's why we went over them, because, you know, what health access are there is, you know, we have the Medicaid, eligibility, and you can check based on your immigration status by going to Bitly, immigrants, eligibility, Bitly/immigrant, immigrant ineligibility. These Bitlys are hard to say, y'all, but trust me, they're way easier than the whole link. And then they're also based on income, Bitly, medical eligibility, find a clinic, free COVID testing, all of these Bitlys, you know, you'll have it as well. And how to advocate for yourself, right? I think that's really important, like when deciding if you even want a vaccine, right? That's a part of it, right? So you can also speak to a lawyer, right? To just, you know, make sure that you feel confident with your decision moving forward. Like, okay, wow, like I can actually use this and it's not gonna affect me, right? That reassurance is really nice. And lastly, just create a plan, you know, just get prepared, because when you're prepared, you know, sometimes there's things that you can't change, but when you're prepared, you know, you can, you know, switch the trajectory as to where you're going, right? And lastly, use your voice. I think that's why we're all here, to kind of see how we can strategize and uplift our stories and our voices and our needs, right? And just continue to practice that, because that's all about caring for ourselves and caring for one another. And all of this, you know, is all embedded in, like, you know, the personal, right? Like the personal, systemic, and political acts, you know, that transform our world towards justice, right? The personal, please use your platform, right? Elevate your story, elevate. I sometimes tell people like my own story, because I went through some really health issues, and just navigating, you know, gives folks a little glimpse into, you know, the world that we have to force navigate, and maybe even get someone to join the fight as well and be like, I also went through that. Let's get and organize and get more rights, right? Access more to health, right? So yeah, just uplift and share also the content hub too, because we've really, you know, acts of love, we've tried really hard on this. So please share the love, share the resources, right? And also lead events like this. I think, again, what's more powerful than just seeing community come together and say, hey, let's organize towards something to our collective healing, and you know, ensure that we're all taken care of. I think that's super powerful, and I think that's what keeps the movement going. So please visit ImHealth training to get started and start your own you know, events, because we need more of these. We need more folks to join the fight. And lastly, you know, host the informations on your platforms, on your organization websites. Trust me, our IOIC's org website still, it's on maintenance, but once we're, you know, launched it, you can bet that this is going to be on it too. So, and to support with like links of like online material, you can, you know, contact Benjamin Chow from the California Immigrant Policy Center. That's their email right there, bchow@immigrants.org. And then a part of it as well is to, you know, the system. We have to understand the system, right? To be able to like transform it, right? To navigate it as well, right? So folks already kind of gave you all some, you know, tips, and also just a little bit more clear picture of what it is, right? So that we can navigate it better and use the resources, right? So yeah, that's the main point here, is just sign up, use it, ensure that your families are using, ensure your friends, your vecinos, like, you know, everyone right now. I think what COVID has showed is that everyone, health is interconnected. So all, you know, we need to continue to ensure that we're all taken care of. And then as well as the political, engage and challenge power. I think a lot of folks have shared that, you know, part of advocating is not just, asking for the resources, but for more, right? To imagine like what I want, like to demand for more, right? That's the whole point, is to imagine something beyond just what we have, but actually, that's why we even have health for all, right? That's our imagining of like everyone is going to get health, and that is our mission, and that's what we're going towards. And I, just by you all being here, I can, hope that you're also on board on that campaign. But yeah, and then also just use your voice, make it a habit, because, the more that you practice voicing your needs, the more that, it's a part of self-care, I would say. Is just saying like, this is what I need, this is what I want, and I'm going to work towards this with other community members who also have the same values, and of supporting one another and ensuring that we're all healthy, safe and thriving. I think that's the main point, as well as empowered, right? It's an empowering act to decide what's best for your body and your health, right? And I can't, all of this like strategy, right? I have to give a huge shout out to Hector T. Plasencia for creating the social justice action model. Overall, this model provides context and simplifies the different components needed to work towards justice and care for each other and to transform the world. And to transform the world, we need to engage with power. We already kind of and challenge it, right? The political, understand and navigate systems, and practice personal and collective healing, which is what we're doing here, right? I would say it's a perfect example. And so, yeah, I hope that y'all take the social justice model and everything, all the resources, all the messaging, all the tips, all the bit links, all of that, and just continue to uplift it and share. Because, like Maribel shared, like we're just echoes to the community, and we want you all to just continue to amplify so that we can grow the movement, but also ensure people are safe again and healthy, thriving, and empowered. Yeah, and I think that's kind of it. There's more on like the more of the Instagram posts, but yeah, y'all feel free to use them, and I think that's my time. But yeah, thank you.
Thank you so much, Ana Jaira. That was amazing. And yes, very much needed information that needs to be continuously repeated. I know there was at the point in terms of emphasizing that getting care is about caring for yourself to be able to care for your family. And it makes me think a lot of our parents and abuelos también, right? They're the ones that care for everybody and they put themselves last, but we got to make sure that they are centered, right? Porque a veces son los pilares de nuestros hogares. So thank you, Ana Jaira. And I think this next section is going to be really important for all of us to just brainstorm and strategize. How can we get this information out there to our parents, to our community? And so what I want us to just be reminded of is that systems and policies do not define the worth of immigrant life. And we really hope that this information is useful for you to promote and continue to protect immigrant health. So what we're going to do next, I'm going to share with you a couple of questions that I want you to think through. And then we're going to break out into groups. And then that way we kind of discuss some of our ideas, comments, things that we can do to ensure that this information gets out there throughout our entire state in California. So these are the questions that I want you to think through, and we'll go ahead and put them on the chat box as well. But they are, why is sharing this information important to me? What personal gifts and talents can I use to promote immigrant health? Who can I collaborate with to promote immigrant health? And when and where can I share what I learned about immigrant health? And the questions are right here on this slide. So take it just a few minutes to reflect on this and think through how these questions apply to you. And I do see that folks did write down some ideas in the Jamboard. What I do want to ask is if folks maybe from each team, if someone would want to just share out a couple of ideas or things that they heard. And we should definitely continue this conversation. Maybe I want to say this was intentional so we can continue outside of this training. But maybe I can ask, we'll go by groups if that's okay. If someone from group 1 would want to share an idea or two that came out in your group.
Yeah, we were talking about, well, that was the Spanish one, creo.
Creo que sí, Temi, sí.
Ya, entonces estuvimos hablando de que, pero no puedo ver las preguntas. ¿Pueden ir al siguiente que era?
Las preguntas, espérame. Déjalas sacamos. Y las ponemos en el chat box. La primera era por qué es importante compartir esta información para ti. ¿Cuáles talentos personales o regalos tienes para promover salud inmigrante?
Ajá, bueno, pusimos que es importante, la razón por la que es importante para nosotras es porque queremos compartir la información con nuestra comunidad, con nuestra familia, porque muchas veces por la falta de atención algunos pierden la vida y de esta manera es una ayuda para que se dé a las personas esta información y a uno mismo. Y también porque nuestra comunidad no tiene mucho acceso a cuidado médico y es importante porque no necesitas tener demasiado dinero para cuidar tu salud. En los talentos compartimos que algunas son buenas para correr la voz, para compartir información, no tienen ni miedo de hablar, la comunidad confía en ellas, son amigables, saben usar las redes sociales, también tienen el talento de promover la información. Tenemos muchas ganas, pero a veces dicen que no tienen tanto tiempo, entonces no es por falta de ganas, sino por falta de tiempo, ¿no? Pero también tienen empatía, son muy empáticas y saben escuchar, ¿no? Entonces, ¿cómo podemos colaborar con otras personas de la comunidad inmigrante? ¿Cómo para promover la salud de nuestra comunidad inmigrante? Nosotros pusimos que colaborar con otras organizaciones, crear talleres, o sea, como empezar a hablar con otras personas, como nada más en nuestra comunidad, como en las conversaciones de la vida diaria, ¿verdad? Y luego dice que when and where can I share what I learned about immigrant health? Pues decían que puedo compartir, algunas son promotoras, ¿verdad? Entonces, aunque la información no sea específicamente del tema, se puede compartir en esos talleres de promoción para que nada más crear como más, darles más herramientas, pero prácticamente en donde sea, con quien se acerque y en cualquier conversación que se preste, ¿no? Es así como de, ay, ¿te enteraste? Como en vez de tener el chisme, decir, bueno, en vez de hablar de alguien más, entonces hablamos de, ay, ¿te enteraste de los programas? O ¿te enteraste que todo esto está pasando, verdad? Entonces, compartirlo con nuestras redes sociales, en nuestra comunidad. También alguien decía que compartiendo volantes en lugares públicos y nuestras organizaciones pueden imprimirlos por nosotros y nosotros darlos como en los SWAT meets o en los afuera como de los centros de salud o en los, ¿cómo se llaman? En los supermercados, en los centros de vacunación y donde se encuentre como esas personas, ¿verdad? Luego también alzando la voz y compartiendo la información con líderes comunitarios o con personas que conozcan a más grupos donde ellas puedan compartir la información. Por ejemplo, creer que nosotros somos líderes en sí mismas y no necesitamos el permiso de otras personas para compartir la información, ¿no? Que si de repente estamos en un grupo de Facebook, de WhatsApp o lo que sea, es como de, pues ahí les va la información, o sea, no les tenemos que preguntar, pero también como pensando en la otra persona como otra líder comunitaria. Decir, yo sé que ella conoce a más personas, entonces voy a darle la información aunque no lo necesite.
Sí. Muchas gracias, Denise. Estuvo todos los puntos. Me encantó lo que puso también Kelly en el chat box. Puso el chisme es la salud. So, me gustó mucho cómo lo compartieron. Gracias. And so I do want to ask folks also maybe just for sake of time, if a couple other groups want to share maybe one observation or idea that came to you, maybe group 2, do you have something in mind?
Hi, group 2 here. You know what? We weren't able to finish all the questions, to be honest, but I will say our group was very well versed in, we had also the promotora model come up, and that was like really interesting to see. And we had people with various talents. We identified that because some of us come from like immigrant backgrounds or have people who are directly impacted by the lack of information and access to healthcare, that has instilled in us the ability to, be patient, guide folks through these complex systems, and also to want to empower folks to do these things on their own and create that sense of power within them. And I think it's also, there is a need for collaboration amongst different areas. We had someone, oh my gosh, and I'm going to forget right now, but it was a skill that was very important. Behavioral analysis, or if I'm not mistaken, how to utilize the talents that we have already to go back into community like churches, clinics, schools, in order to really make sure that folks have access to these crucial services. I'll leave it as that because for time's sake, but I'm sorry, my notes suck, but I'm sorry.
No, don't apologize. And no, they don't suck. All is good. Thank you, Maribel. So I know also just for sake of time, if somebody else wants to jump in and maybe mention something that y'all were in the middle of, we can go ahead and do that. I do want to make sure that we have a little bit of extra time to, just in terms of additional support. All the ideas, and I want to read through them, see what other ideas folks came up with. This is great. I think una idea que alguien no pensó, alguien más la tuvo, so we can always collaborate, right, in that end. But I do want to make sure that folks want additional support. I want to make sure that y'all understand and know that it's available. So if folks want to do or receive another training for your members, or collaborate with another org and receive this information, we want to make sure that you know that it's available. So what I'm going to do is I'm going to go ahead and add a link to the chat box. Let's see, right here. So that if you request this information, we can connect with y'all and make this possible. Thank you, Temis. Here we go. And y'all can see the slide about the training request. So yes, this can't and will not stop here. I think this is just the beginning. And I think what's very exciting is to see and know that folks are coming together, right, to get this information from throughout the state and even by nationally. I'm really excited also for the conversation that we had in our group about also ensuring that our community in La Frontera is being served and has the information, accurate information to access healthcare. I also just want to give us a little bit of time to do an evaluation. We want to make sure that we hear from you, receive your feedback, get your comments about your experience today. How can we improve it? And so we honor and appreciate your honesty. And also we'll honor your privacy. So you can include your name in the evaluation. It's optional if you'd like to. If you do, we'd love to follow up with any thoughts and ideas and feedback that you'd have. Otherwise, it'll be anonymous, but it will definitely help us improve this presentation and the information that we're getting out to that community. So let me get you all the link real brief. So if you can take a few minutes, no se nos vayan todavía. We do want to make sure that you have, or that we do have time together to close out in just a few minutes. So let me go ahead and share with you all the link to the evaluation. Denme un segundo. Here you go. And I do want to remind you all that we're going to follow up with an email and share with you all the resources, the links, the slides, and also the recording. Yes, thank you for completing the evaluation. If you do finish it up, you can also put an emoji with the celebration, así como que ya acabamos. O estamos acabando para empezar. And then we can move into our closing remarks. Awesome. All right. I feel so blessed. Yes, well, today, this is our second session. I'm really, really excited just to see the folks that came together, the energy, las ganas. Right, we always try to figure it out to make sure that our community is being served como se debe. So to close out, I do want to ask everybody to maybe just think about one word about how you feel right now after receiving the information, compartir este espacio, de este tiempo con todos nosotros. What's one word that describe how you're feeling? And you can go ahead and put it in the chat box. I can also encourage you to maybe turn on or unmute yourself and put it out there, put it into your universe so we can get all that energy. Temis, muchas gracias. Hopeful, grateful, thankful, inspired. I am feeling inspired and hopeful and grateful también. Thankful, amazed. Definitely feeling very much connected. So even though I may not know you all in persona, se siente muy, muy chida la conexión, and I'm excited to know that y'all are out there in our community. Courageous, renewed. Oh, I like that one. Joyful. Yes, inspired and hopeful. Supported. Yes. Powerful. Natividad. Yes. Jesús, grateful pero muy cansado. Yes, it is a long day. Y les mando mucha buena vibra so y'all can continue to just wrap up your day con muchas bendiciones. Thank you. Irma, con ganas de compartir. Yes. And let's see. I think we do also have a hand up. Carol, if you want to unmute yourself.
Hi.
Hola.
Just wanted to know if you would be able to do a training for my Promotores program on the importance of promoting immigrant health and, you know, just giving them all the logistics. I thought the information was really to the point, really informative with a lot of resources. And I think that if they have that in their little bag of tools for when they're out with the community, it would just be really helpful. Just making sure they know everything.
Thank you so much, Carol. And yes, I'm actually gonna send again on the chat box the link so we
Okay.
can get your information. So that way we can connect and and we can coordinate that.
That
So
would
I
be
can
great.
put it in
Thank
the
you.
chat box as well. Thank you also for looking out and trying to expand folks that can receive this information. Awesome. Well, this is very exciting. Thank you all once again. Muy agradecida. I think we're going to wrap up con muchas ganas. There we go. There's the link again. If anybody else would like a training for other folks, please fill out the form, the request form. Y aquí no queda, right? No paramos aquí. This is to be continued. So thank you all once again. Gabriela, thank you. Yes, I'm feeling very much in community y con muchos ánimos. There we go. Well, that wraps up our day, our time together. Mi gente, once again, thank you. Use all platforms possible, your social media, sus círculos. Every moment is a moment to ensure that our community has the right information. So if anybody wants to unmute themselves and say anything, when they open up that opportunity. Y si no, los emojis están chidos, I can feel the energy.
Solamente quería compartir, darle las gracias. Me parece una cosa increíble poder encontrar todos estos recursos en un solo lugar. Y más porque realmente queremos, o sea, esto es como bien difícil de navegar y una de las cosas que estaba poniendo ahí era como que está increíble, como que sea accesible, pero también me gustaría saber cómo es que podemos hacerla inclusiva y cómo podemos navegarlo sin, o sea, porque a veces como inmigrante, ¿no? Te tachan como de ignorante. Bueno, a mí me dijeron eso y yo así como de, ¿what? ¿No? Entonces estás en un momento tan vulnerable que entonces es cómo es que nos entrenamos nosotros como inmigrantes para que enfrente de los doctores se respeten también como nuestros derechos y cómo es que podemos advocar, que se nos enseñe a advocar por nosotros mismos para que podamos evitar estas, como los malos diagnósticos o las largas filas, las esperas, ¿no? Entonces, me encantaría ver eso. Yo sé que están haciendo un increíble trabajo y los felicito. Y también, gracias a Héctor, me encantó cómo es que tenemos que checar con nosotros, cómo podemos enseñarle a nuestra comunidad a darnos estas herramientas. Muchas gracias. Me encantaría como que también tener solamente un entrenamiento de solo eso, de cómo embody ourselves. Pero no sé, muchísimas gracias por darnos toda esta información. Voy a revisarla más a fondo, voy a compartirla. Definitivamente les voy a pedir que hagan un taller con nosotros. Pero sí, como enseñar a nuestra comunidad a advocar, qué es lo que sí tiene, qué es lo que, cómo es que podemos eliminar toda esta sensación de este señor como que no me está escuchando, como que cómo realmente puedo decirle lo que siento, y que se respete como mi experiencia. Entonces, muchísimas gracias, estoy muy emocionada.
A ti, Temis, gracias también por compartirnos, darnos las ideas de cómo podemos darle seguimiento a esto y enforzarlo, ¿no? Así que sí, le vamos a dar seguimiento a todo esto. Muchas gracias. También veo que Kelly y Carol tienen sus manos levantadas. So Kelly, if you want to mute yourself.
Yeah, I know that we just started with this today, but you know, I really loved it. So I want to know if there is more to come, and if there is more to come, how can I get more involved in it? Are there other Latino roundtables that we can attend to just know more about what's going on? I guess I'm just looking for additional extra resources.
Thank you. We would love, yes. I know that in the evaluation, it says if you want to be a presenter. So everyone that mentioned they want to be a presenter or a little curious about it, we're going to send them additional information of being connected to the work group of California PIF. That's structured and organized everything, simplified. It's been like 2-3 years of just trying to simplify the information. And so there's clearly a lot more work that needs to be done around just specific pieces. We are already developing that as well. So what we shared with you today is very general. We also have other different buckets of specifically what is it for, like for children, specifically what is it like for farm workers, specifically what is it just for food. So in all of these different areas, we want to have more detailed information, but just for today, we wanted you to just get an overview and come and have those conversations with us about maybe having a series, what that would look like. But overall, just we would love for your involvement. So you'll hear from us soon. Gracias.
And Carol, I knew you had your hand up, but not sure if that was from the previous question that you had.
Yeah, it was from the previous question.
Oh, man.
I already lowered it.
Gotcha.
Thank you guys so much. I thought the information was awesome, and I really like the messaging that Najira gave us, like just the very specific messages. I think those were great. Thank you.
Thank you for the feedback. All right, everyone. Well, yo les quiero desear a great rest of your evening, con mucha buena vibra, mucha energía, lots of bendiciones. And yeah, stay tuned for that follow-up email with all this information. Muchas gracias a todos.